I want to show you how much work this can be. Sometimes people are coming to us with morphine.
Včasih pridejo ljudje k njim z morfijem, ki so že na morfiju.
Morphine is always the beginning of the end.
Morfij je vedno začetek konca.
So you have to take away the morphine.
Zato je treba morfij vzeti stran.
But how do you do this? This is not an easy thing.
Ampak kako, ker je to zelo težko?
So I tell the patient, do every hour or every second hour a coffee enema.
Zato gospod svetuje pacientom, da vsako uro oziroma vsako drugo uro naredijo klistir s kavo.
Who in this room has done a coffee enema?
Kdo od vas je že naredil klistir s kavo?
2, 3, 4. Okay. You know, I know. When I did, it was in Mexico, when I did my first coffee enema in my life, it's a strange thing.
V Mehiki je gospod prvič naredil klistir s
I have
kavo.
2 children, 2 sons, and in the old days they said to me, Daddy, Mama, you are the most crazy people in our village. You are the only one who don't drink the coffee, do the coffee from that side.
Dva sinova ima gospod in sta mu rekla, da sta oni in njegova žena najbolj nenavadna starša, ker namesto da bi pila kavo, kako vsi običajni ljudje, si jo vlivata v telo z nasprotne strani.
And even without sugar and cream.
In to celo brez sladkorja in smetane.
So, I know it sounds strange, but a coffee enema is an unbelievable good therapy.
Klistir s kavo je neverjetno dobra terapija.
Why we are doing this? First, as a painkiller.
Prvič je to zelo dobro protibolečinsko sredstvo.
I can't explain to you, by the way, why. I don't know it.
Ne morem vam reči zakaj, ker ne ve zakaj.
I was reading everything what I could find in libraries about coffee enemas, and until today I have no idea why it is working. I don't know it.
Prebral je vse možno literaturo o klistirju z kavo, vendar še ni ugotovil zakaj.
But if you don't believe me and you have next time headaches or migraine, then do a coffee enema and you will understand what I'm speaking about.
Vendar, če ne verjamete, naslednjič, ko boste imeli glavobol ali migreno, si privoščite en klistir s kavo in boste videli, o čem govorim.
The second reason for the coffee enemas is that we want to support the liver.
Naslednji razlog, zakaj je to dobro, je, da v bistvu podpremo na enem nivoju jedra.
And each cancer patient has a liver problem.
Vsak pacient z rakom ima težave z jedri.
So we want to support the liver through the coffee acid and the caffeine which is in the coffee, and it goes to the liver and then you push the liver to work more.
V bistvu kava oziroma kofein pomaga jedrom, da lažje oziroma bolj delajo, so bolj aktivni.
But sometimes it's not an easy thing to do 2, 3, 4, 5, up to 10 coffee enemas in one day.
Vendar res včasih ni glih najbolj lahko, da se naredi 1, 2, tudi do 10 klistirjev s kavo na dan.
It's also not easy when I tell a patient, go home and tell your wife or your husband that your sexual life is a disaster.
Tudi ni zelo lahko je domov in recimo reči ženi ali pa možu, da je pač naše spolno življenje katastrofalno.
It's also not easy to tell your son when he's 25 years old and he's still at home that you say, you better, I kick you out now.
Tudi je težko je domov in reči 25-mu sinu, ki še vedno živi doma, da je čas, da gre v doma počasi.
I'm just saying this because Alexander told me today that in Slovenia it's quite normal that children over 20 are still at home.
To je povedal zato, ker je v Sloveniji.
I don't know whether it's true or that, but I tell you, better kick them out a little bit earlier, okay?
Ker je v Sloveniji tak običaj, da ljudje zelo dolgo ostanejo doma in imamo zelo dolgo otrok.
But you know, all these things, they sound so easy, but it's not that easy.
Vse te stvari zvenijo, kot da so lahke, vendar v resnici jih ni lahko uresničiti.
Just tell your husband he shall not drink so much alcohol can be a big thing for some people.
Samo reči možu, da ne pije manj alkohola, je za nekateri ljudi zelo velika stvar.
Because we always want to keep the things how they are.
Ker vedno hočemo ohraniti stvari take, kot so.
We hate changes,
Ne prenašamo, ne maramo sprememb.
but we need them when you are serious ill.
Vendar jih nujno potrebujemo, ko smo resno bolni.
The fifth point is, I don't agree with the conventional medicine that we always have to destroy a tumor.
Gospod se ne strinja s konvencionalno medicino, da je tumor treba vedno uničiti.
Sometimes, yes, I'm sending patients to the surgeon and tell them, cut the tumor out.
Včasih ja, včasih on sam pošlje pacijente pač k kirurgu, da izrežejo tumor.
But sometimes there's no need to do this.
Včasih pa ni potrebe potem.
And with breast cancer, if there is a small tumor, why shall I cut it out?
Z rakom na prsih, pri primeru majhnega tumora, zakaj bi ga izrezali?
I do detoxification, I change the life, I will become very happy and the tumor will go anyway.
Z razstrupljanjem, s spremembo načina življenja, z tem, da postanemo bolj veseli, tudi tumor počasi skine.
But of course, you only can do this if your patient can sleep.
Vendar to lahko naredite samo, če pacient lahko spi.
If your patient can't sleep because the patient is so anxious, I send them to the surgeon.
Če pacient ne more spati, ker je toliko zaskrbljen, ga gospod pošlje k kirurgu.
But even large tumors in the colon can go within a few weeks sometimes.
Vendar tudi veliki tumori v črevesju lahko v nekaj tednih sami izginejo.
The biggest tumor I personally have seen my whole life was the tumor in the belly of a man, the size of a head. It was totally disappearing in 3 weeks.
Največji tumor, ki ga je gospod videl, ko ga je imel gospod ta pacient v trebuhu, verjetno tudi tisto, ki smo govorili na začetku, je izginil v 3.
We all couldn't believe it, because this is not a normal thing, but it is possible.
Ponavadi mi tega niti ne verjamemo, ampak je mogoče.
And you have seen all this big tumor on some of the pictures. A tumor can become very big without killing you.
Tumor lahko postane zelo velik, to, ko smo videli prej na sliki, vendar vas ne ubije.
But if you are anxious, you can't sleep, and the fear is so big, it will kill you.
Vendar, če vas je strah, če ste zaskrbljeni, potem vas bo tumor ubil.
This is why I'm so upset and not happy at all how the word cancer is used today. Today, in the public, in the medical world, in Hollywood, you know, the word cancer is always used like the most deadly illness.
Zato je gospod tako jezen, ko se v javnosti, v medijih, v filmih, ko besedo rak uporablja kot najbolj smrtonosno bolezen in omenja kot najbolj smrtonosno bolezen.
I'm the last person who is not knowing that cancer can kill you. But if you want to see really bad illnesses, you go to a neurological hospital.
Gospod je rekel, da ja, on se zaveda tega, da rak vas lahko ubije, vendar pa, če želite videti res prave, tiste resne bolezni, potem božda greste na neurološko.
So don't be so afraid of the word cancer.
Zato se ne tako bati besede rak.
Yeah. Rak is not that deadly illness.
Rak ni smrtonosna bolezen.
And cancer is not killing you even in a late stage.
In rak ni nujno, da vas bo ubil, tudi če je v zelo poznem stadiju.
I have seen patients, they had metastases all over the body.
Gospod je videl pacijente, ki so imeli metastaze vse posod po telesu.
And they came back to life.
In so se v bistvu vrnili v življenje.
When they find the switch.
Ko so odkrili tisti preklopelj.
Of course, as more you in the illness, as more final the illness is, as more the patient is believing that he has to die.
Res je, da bolj ko je ta bolezen postaja resna, bolj ko se razraste, bolj pacijenti verjamejo, da morajo umreti.
So if a doctor is telling you, you have to live, I don't know, maybe 6 or 12 or 24 months, don't trust him.
Zato, ko zdravnik reče, živeli boste še 3, 6, 14, 12 mesecev, kako že, nikoli mu ne smete verjeti.
If a doctor is saying, we can't help you anymore, then just tell him, okay, you can't help me, so I go to somebody else.
Ko vam zdravnik reče, da vam ne more več pomagati, vi enostavno rečete, prav, vi mi ne morete več pomagati, pa bom šel nekam drugam.
And this somebody else is first you.
In tisti drugi, kamor boste šli, ste najprej vi.
I agree that conventional doctor, when you have metastasis, they can't help you with chemotherapy and radiation. You have to die with chemotherapy and radiation in this stage.
Gospod verjame, da vam konvencionalna medicina s kemoterapijo in radiacijo, ko ste enkrat v zadnjem stadiju rakave bolezni, ne more pomagati.
But this means not that you, and maybe some support from some other people, can't help you.
vendar to še ne pomeni, da si vi sami in mogoče pomoč s kakšne druge smeri ne more pomagati.
Yeah. In a very, very late stage, you can get it, but you have to trust yourself, you have to expect that you become healthy, and you need a high discipline.
Tudi v zelo, zelo poznem stadiju bolezni morate verjeti, da boste ozdravili, to pričakovati in potem se lahko to tudi zgodi.
And the most important thing tonight I can tell you is that we all together today can live together another day in this paradise.
In zadnja stvar, ki vam bo Gospod še povedal, je, da vsi skupaj lahko živimo še en dan skupaj v raju.
Thank you very much.
Hvala.
Zdaj, hvala gospodu Lotarju za to, da je izčrpno pojasnilo. Zdaj lahko preidemo na nekaj vprašanj. Pa morda bi prosil, da ste disciplinirani, da ne govorite en čez drugega, tako da bo kdo imel kakšno vprašanje.
Dve vprašanje imam. Nisem zasledil v knjigi...
Anja?
Ja?
Nisem zasledil v knjigi, če ste kje omenjali klorofil. Klorofil.
Aha, klorofil, ja.
Spirulino, klorelo, recimo. Pa kot maserja me zanima, kaj se lahko masira, kdaj se lahko masira.
The gentleman's asking about the massages.
Massages, yeah.
Yeah. How many massages, what kind, when are appropriate in case of
Well,
cancer? Gospoda je zanimala, kakšna masaža, oziroma katere masaže in kdaj so primerne za rakave bolnike. To je bilo drugo vprašanje, prvo bom pa še enkrat povedala.
Well, there are, in different health systems, like Ayurveda, like Chinese medicine, but also in Western medicine, there are a lot of different kind of massages. For me, when they use massages, for me the more important massages are massages like in Ayurveda, where you do the toxins out of the body.
Najpomembnejše se gospodu zdijo masaže, ki se ponovadi v Ayurvedi prakticirajo, ko se nekako pripomorejo k temu izločanju toksinov iz telesa.
So normally they use different kind of oils to do these massages.
Navadno uporabljajo različna olja za take masaže.
But a massage sometimes can also be getting some nice waves from somebody else.
Pač med masažo je to ta izmenjava nekih valov strani druge osebe, recimo, ki jih maseja daje.
Or we sometimes use these massages if we think somebody is totally blocked. And because if somebody is totally blocked, it's also very hard to talk to him.
Masaže so primerne tudi ljudi, ki so recimo zelo zablokirani, da se nekako lažje odprejo in da je potem lažje z njim komunicirati.
So for me a massage is just not that I prescribe a massage. You have to think about for which patient, which kind of massage could be very good.
Ja, ko se v primeru masaže dobro poznati, katerega pacienta, kdaj, kakšna masaža je za njega primerna.
On the other side, I nearly don't understand what kind of massage is not good.
Po drugi strani pa, katera masaža pa ni dobra, ne, zaradi tega.
I would say nearly all kind of massages are quite good.
V bistvu so vse masaže pozitivne.
Ne, zato ker pravijo nekateri, da takih rakavih bolnikov ni dobro masirati, da ne bi se kaj raznesel.
Some say that cancer patients are not supposed to be receiving massage
because
the illness can spread.
Cancer patients, they should not do massages, they should not go into the sauna, they should not do this and that. I heard hundreds of times, why is a doctor saying that a cancer patient should not have a massage or cancer patient should not go to the sauna? Because they have a totally confused mind, some doctors, okay?
Gospod pravi, da v bistvu se velikrat govori, da ja, rakavi bolniki ne bi šli v savno, ne bi bili masirani, ne bi to, ono, tretje, ampak pravi, da je to zato, ker so pač zdravniki več ali manj sami zmedeni.
Because they think when they give a massage, the tumor cells will run better through the body and making new tumors.
Ja, ker pač pravijo, da nekateri so pač pripričani, da če šli na masažo, s to masažo se bo potem še razširile te rakave celice po telesu in nekje druge naseline.
How stupid must one person be to believe things like this?
Ampak kako neumna je lahko oseba, ki je nekaj takega verjame.
Or quite often, doctors are saying to patients, don't go to the sauna.
Veliko zdravniki rečejo pacientom, ne jedite savno.
I say, go to the sauna.
On pravi, da ne grejo pacienti.
Because everything what brings toxins out of your body is good for you.
Ker vse, kar izloča strupe iz telesa, je dobro. Ne?
Of course, if you have a lung or a heart problem, maybe you should not go to the sauna. But because of your tumor, you should go.
No, če imate težave z pljuči ali pa srce, mogoče res savna ni najboljša opcija, ampak če imate pa tumor, pa nedvomno morate.